Management Seminar class. My name is Maya Kim and I'm part of the Patient Safety Group. If you've had the opportunity to review the reading material and objectives, you will notice that we have focused on the process of team step. Our group unanimously agreed on this process to assist with communication breakdown. Team STEP was developed by the Agency for Healthcare Research and Quality, and I hope you guys have enjoyed the information that our group has posted. Tonight I have the privilege of interviewing Lisa Allen. She is a bachelor's prepared nurse, and she's a nurse manager over 57 medical med-surg beds. Ms. Allen has been a nurse for over 12 years, and she's also working on her master's in nursing. And in 3 months she will be done with her program, so she completely understands our pain. Although we'll be through in 6 weeks. She has been a nurse manager for 3 years, and over the last 3 years, Ms. Allen has been a champion for patient safety, quality, and workflow processes. What I found, and when I was given her name, what really impressed me was some of the information that the person who told me about Ms. Allen just shared some really great information of things that she's done on her units that have just been impressive and that has just really spoke to me about patient safety. She's had 0 CODI fallouts in 5 quarters, 0 CLABSI fallouts over 4 quarters, 0 VTE fallouts since she's been manager, 0 flu fallouts since the flu season has started, the 2013-2014 season, 0 pneumonia fallouts in the last 5 months. She partnered with the nursing staff in the development of a standardized report sheet on one of her units that has since been rolled out for the whole facility for the medical, surgical, and telemetry units. Ms. Allen has also worked with the nursing professional development and project managers to improve VTE process in the electronic medical record. And also she championed a re-education of the nursing staff regarding anticoagulant therapy. She also has developed a charge nurse education series that focuses on leadership, accountability, and professionalism. You've been a very busy lady in 3 years.
I have been very busy.
So, just having a little time to spend some time with you today, one of the things that I've noticed in your interaction with your staff is that you really have built a culture of ownership or accountability for your staff. How did you make that happen? Because it's my understanding one of the units you opened from day one. You were the manager, you built the staff. I don't know if you were able to handpick your staff or things of that nature, but you own all the processes that you guys developed on that floor. So can you tell me a little bit about that?
I think the advantage to opening up a new unit from the ground, honestly, was we were afforded some time to team build with one another. So, and also the staff, some of the staff, because they transferred to this floor from another area, and then some were hired in, and they were just working throughout the hospital until the floor had finished being built. But they were able to come in also and kind of pretty much design the layout of the unit. They were able to, put forms in places where they thought was going to be nurse friendly, nurse user friendly. And we got to sit around and truly did some team building exercises. We laid out the expectations for the unit. I did, and they did as well of what they expected from the unit and from the manager. And I think that day, honestly, I sold them a vision.
Okay.
I sold them a vision. And we stayed with that vision. And part of that vision was communication and teamwork, which you mentioned there in team steps, which team steps, that's what it's about. We didn't actually formally utilize team steps, but as far as the evidence-based approach to optimizing patient outcomes and safety through communication and teamwork, that's what we've done.
Okay. Well, let's go back to some of your accomplishments, because like I said, again, it's pretty impressive. 0 CODI fallouts in 5 quarters. That's really amazing. How have you developed this patient how have you developed the safety net to keep these patients from falling out?
Patient safety was a part of the vision.
Okay.
And we've never lost sight of that. Then we had to build processes, to make sure that we were able to do those audits of the patients with the Foleys, regardless of what staffing looked like that day, regardless of what was happening that day. processes that we had in place, we had to have a plan A, B, and C
Right.
to make sure that those processes still happened
Mhm.
and kept our patients safe. And that's what we did. And that, and as far as the no cotty, that was a collaboration between the nurses and the nurse aides. Because the nurse aides, they spend a lot of time with the patients too, and making sure they're doing the catheter care and making sure the Foley bag into the ground and no
Right.
kinks. And so it wasn't just all the nurses. It was really truly, when I say teamwork, it's teamwork for that.
Well, and we know that, of course, patients come to the hospital for the nursing care.
Yes.
But we also know that there's somebody who drives that care, and that's the physicians. Can you touch upon how you have been able to get the physicians to buy into the vision, into the patient safety vision that you have built for this unit?
I'm not sure if I truly quite got the, at least not the buy-in of every physician, but I think most, yes, because some physicians do request their patients, patron 12 East. But they know that 12 East is about accountability, honestly, and the patients. And initially, it was, one of those things, when patients come to the floor, when the physicians come to the floor, you do introduce yourself, you're the nurse manager, and this is the expectation. And really, the same vision that I laid out for the staff, I had to lay out for the physicians also. I did have to have some tough conversations with some, I had to explain to them time after time some about the protocols and the processes and the reasons why and the reasons why we don't take shortcuts in the processes.
Absolutely.
And bottom line, the nurses and myself were responsible for the outcomes for these patients on this floor.
Okay.
And we wanted to make sure that they had optimal
Okay.
outcomes.
And which is what you'd want for any patient that
Yes.
comes into any facility. You want them to leave in better shape than what they
Yes.
arrived in. And as nurses, we are a big part of that. Patient safety should be like if not our number one priority, our number two priority. So was there any event that has made you change your process? Could it have been a sentinel event, a near miss? Was there anything that's kind of made you have to really think about a process and tweak it?
The only process that you mentioned, the standardized patient report sheet, the
Yes.
handoff that we do, that came about from our culture of safety survey that the nurses do yearly. And one of the low responses was that they felt like important information was lost during handoff.
Okay.
And it was not so much from nurse to nurse on the unit, but sometimes it was from the patients that were transferring, from being downgraded from the ICU or telemetry. So with that, we did a deep dive, extensive literature review, and we TCAB'd a standardized report sheet.
Oh, wow.
It was a rapid change for the floor, and UVC and nurses put that report sheet together again based off what was out there in the literature. You know how they say steal shamelessly?
Absolutely.
Absolutely. That's what we did. And it's worked, as you said. It's
rolled out to the all med surge units and telemetry units. I mean, so that's, for your staff, that's got to make them feel very empowered.
Yeah.
Very empowered. I mean, because they saw a process that was broken, and they figured out a way to fix it, and it benefits the patients.
Right.
I mean, it keeps them, those little important things are being communicated to each nurse, therefore we're preventing a fallout.
Right.
So patient safety is definitely being upheld, and like you said, extensive research out there is supporting standardized report sheets.
We already did the bedside report, but the bedside report wasn't enough.
Right.
Because what you may need to carry on for patient care may not be what I need to carry on for patient care. So we really did have to standardize that some.
Okay. Now, are you working on a nurse aid report sheet?
We are working on a nurse aid report sheet. We are working on that too.
So let's go back to, how do you monitor the effectiveness of your patient safety projects? What's your process? I mean, because of course, you put a process in place. So what's your process to check the process?
We have a project tracker that I update, or Kate, the clinical lead, updates And depending on if the project came from UBC, then the UBC chair updates that. But we update that quarterly. Now, as far as like our CODI and stuff like that, we see that monthly.
Okay.
You know, then we look at it, truly break it down quarterly. But if we're doing our Foley catheter audits, we know even before the reports come out, you know, because we do those reports weekly. We try to do, we do 3 Foley audits a week, and the same with our CLAPSy, which at night, the charge nurses, they go through and we have a log out there where we review the patients with central lines and Foleys too. So, and then we also, St. John has the Foley protocol. So, and it's just like rote now. They know if a patient has a Foley, it's just, do they need this Foley?
Right.
You know, why do they have this
Right.
Foley? And we advocate to have that Foley removed, if, you know.
So let's compare your nursing career when you were at the bedside versus the nurses on your unit's career right now as they're, you know, day to day. Do you feel like the nurses that you have currently versus where you were at, that they are in a better position to advocate for patient safety because they have a leader who's willing to support and help develop and things of that nature? Or do you think where you were at as a nurse at the bedside?
Much more better now. We have evolved. We have too much evidence-based practices and just the research out there to support improvement and better processes. I think the challenge now, though, because there is so much out there, and sometimes things change rapidly,
Right.
even with research, there's
Right.
always that next best practice out there, is getting the nurses to really find time to do that. So initially, I found myself doing a lot of that
Right.
research initially, but now they see the value in it, so I really don't have to spend a lot of time doing as much research as I
So they've
used to.
evolved.
They have evolved.
They've evolved.
They have evolved. But really, I think, which goes back to communication, which, of course, they are accountable for their own practice. And a lot of stuff they do need to go out there and research and bring it in themselves. But at the same time, too, though, I do feel like I owe them that, and I am responsible also to let them know what's out there in the literature and what we need to do to continue to improve our patient outcomes. And honestly, when your patient outcomes are improving, you see it in the staff. Staff are happier. You know, nurses come in, they want to do a good job and they want to take care of their patients. They want to see those results.
Right.
You know, they want that feedback. And if they can see where they're honestly making that difference, they're going to come in and look to make that next difference.
So have any other of your processes, have they been rolled out house-wide, or are they looking to roll anything out house-wide?
The only thing so far that they rolled out house-wide is a standardized report sheet. Now, I know nursing professional development, they did take some of the tools and things that we do when we onboard our staff. Because we do a pretty extensive onboarding with the staff to things which they will get a little bit, but we go in depth as far as central lines and Foleys and restraints and patient satisfaction. Probably, I mean, it's really like a one-on-one versus being in an auditorium full of new hires.
Right. So it's really more individualized and specialized to meet the needs of the unit or the patient population. Because again, like you said, we have to bring it back down to them, or I'm kind of paraphrasing a little, I'm sorry, but bringing it back down to them because the central lines are so important. I mean, if we miss that and we cause an infection, we lose reimbursement, or we pay for that. You know, same thing with CODI, we pay for that. So being in the environment that we're in right now, it's worth it to us to do that specialized onboarding process, which is another safety net for your
Yeah,
patients.
It is.
Okay.
Big safety net.
It is. I mean, because we just have to just keep moving forward and being very innovative. And it
Yes.
seems like you've been very innovative on
yes,
your
yes,
unit to get these wonderful results that you've gotten. I want to go back and touch on one more thing. When it comes to sentinel events, have you ever experienced one on your unit? And if you did, what came out of it?
Sentinel event.
Mhm.
I've never experienced a sentinel event, but one thing that did happen that was pretty, the unit we thought was detrimental, is that we had a patient that was in an enclosure bed, and of course an enclosure bed is considered a restraint, but that patient passed in that enclosure bed. So that was an eye-opening experience as to how we use restraints,
Right.
you know, and our documentation surrounding restraints. Because when I went back and looked, and honestly, and I guess the piece too that got me is that I rounded this patient before I left that night, and that night I guess I probably left at her about 7:30 or 8, but she was a little bit rambunctious, you know, off and on. But then there was periods where he would doze off, and I'm thinking that our mindset, we really did not look at that enclosure bed as a restraint.
Okay.
But it's a restraint. So you know, we had to truly question and deep dive and start looking at best practices out there if we could have did something else for that patient.
Okay. And did you develop any new processes behind it?
No, the floor didn't specifically, but the hospital did as a whole. So we changed some of the documentation piece in the electronic medical record. Also, how we monitor the restraints.
So again, your floor led the charge, is what I'm hearing.
Yes, our floor led the charge.
Because you know it was a fallout, and
Yeah.
you know, one way or the other,
Yeah.
you guys saw that there was a need and you wanted to fix it.
Yeah.
Very impressed. I mean, I've you know, just speaking with some of your staff today, and just spending like I said, spending a little bit of time with you today, it's been very eye opening. For anybody who would want to go into that management leadership role, communication is a big key. And if you do not effectively communicate with your staff, you can't have these wonderful outcomes. You can't have these safety nets in place that, you know, produce the best patient outcomes. You know, like I said, going back reading through all the things that your unit has done and you guys have done, I know that there was no way that could have been done without communication. So I just have to say, you guys are wonderful. Trust me, you would want your family on this floor, because I have seen nothing but wonderful things up here. And the staff are very engaged, and that was just amazing to me to see that. So, Miss Allen, I know you've had a long day. She's been here since very early this morning, and it is now 8 o'clock Central Time. So thank you for giving me your time today, and your
You're
staff.
welcome.
I have been so very impressed, and I wish you guys nothing but success.
Thank you.
If I go back into a leadership role, you're going to be my mentor. So, nursing N5440 students, I'm telling you, I've just had a wonderful day here with Miss Allen, and patient safety. I just feel it is a very needed thing, and we need to really take that seriously as nurses. And I'm telling you, this has just been a floor that has really just taken that, been innovative, and they've just done wonderful things. So. Thank you for your time, and thank you for your time.
You're welcome.
And
You're welcome.
I'll give you the link so you can see